Today we're going to be talking about different side effects when we're talking about CPAP. There are a plethora of side effects, and I'm going to go through them all, the causes, and then hopefully some solutions today. So the first side effect you might notice is dry eyes, red eyes, or just puffiness underneath the eyes. This is pretty much often a mask leak. You're usually looking at a mask like this. This is the main culprit. Now, all masks can leak, but this is a comment that we get from a lot of people using a full face mask, such as this Vitara by Fisher & Paykel or like an F20 by ResMed. And that is because the airflow is so close to your eyes that if you have a tiny little leak right here, like this, a tiny little leak can really get into your eyes quite a bit there. So you can get a mask fit guide when you buy the mask. There'll be like a little thing that you put next to your nose and make sure you get the right size. However, if you don't buy the mask, then obviously you don't have it. So how would you get it? Well, you would get it at the cpapstore.ca. Just look at any mask that we sell, and for about like 90% of masks we sell, probably 95% of masks we sell, there'll be a sizing guide there. So you can click that, and then you can get a ruler, a metric or imperial, and measure your face to make sure you get a right size. You can also try to get different types of full face masks, such as hybrid masks that go underneath the nose and around the mouth. That just has a little air, so if it does leak, it's a little further away from your eye than, as you can see, it's like pretty much on your eye level. Another thing you can do to facilitate this is just running a mask fit test before you go to bed. So you can do that on your machine. That's going to make sure that it's blowing the pressure that you would use when you're actually sleeping to see if there's any mask leaks. Especially if you get a new mask, do that standing up, try to see if there's any leaks. After you do one mask fit test, if it's good, lie down, kind of roll around on the pillow a little bit, try to figure out where anything is leaking, and then look at your mask fit test as well and see if there's any leakage on there. Okay. Last thing in terms of leaking mask is the worn out silicone. So if you have worn out masks that you've been using for like 6 months, this part here that folds into your nose, or the pillows, for example, can get pretty worn. And when they do get worn, they don't like position themselves properly, and you're more susceptible to leaks. So dry eyes, leaks, try to take care of your leak. The next one is dry mouth. So this has a variety of different issues. However, with dry mouth, it's kind of the opposite. Often happens the most when you have nasal masks without any mouth part. That's because you're not getting any humidity into your mouth. And if your mask is open during sleep, you're gonna be either mouth breathing, or you're gonna have all that pressure that's supposed to go down your throat and keep your tongue from being obstruction. It's gonna go through your mouth and out. That's gonna be constantly drying your mouth throughout the night, and you're gonna have a super dry mouth. It's gonna be super uncomfortable. So if you do have a dry mouth, you gotta keep your mouth closed. Now there's some ways you can do that. One way is mouth tape, but we don't recommend that unless you talk to your doctor or sleep therapist about that, because people with sleep apnea who might have central sleep apnea or obstructive sleep apnea, obviously the main thing we're trying to avoid here is you dying in your sleep, you not being able to get the oxygen, the deep breath that you need during your sleep. Having mouth tape on you could present some problems. If the mask kind of leaks or is not working properly, if you have an apnea and you just need to take a breath, if your machine stops working, if there's a power outage, who knows? Just make sure that you're talking to your doctor before you use mouth tape. There are complications with mouth tape for people who have sleep apnea, and just make sure you look into those and talk to your doctor. Generally, a bit safer way to keep your mouth closed is going to be a chin strap. So you can wear a chin strap. That way you can still open your mouth if you need to, but it's going to be positioning your jaw and kind of making you keep your jaw closed a little easier throughout the night. Also, you can practice throughout the day when you're walking around, doing your workout, just on the computer, whatever. Just make sure that you're keeping your mouth as closed as possible so you get used to breathing out of your nose. You should try to be a little cognizant of when you're breathing out of your mouth, and doing that during the day will definitely help at night, because at night your subconscious brain will just be so used to keeping your mouth closed that you have a better time and an easier time keeping your mouth closed. Now, the next thing for dry mouth is going to be your humidifier. Just make sure that you have a proper humidity on. Obviously, everyone using CPAP can have dry mouth, even if you're really good at keeping your mouth closed. So just make sure you have humidity on at a decent humid setting, so that if you do have a little bit of air going into your mouth, flowing through your mouth throughout the night, for here and there, 30 minutes here, 30 minutes there. At least it's humid air and it's not super dry. So make sure you have your humidifier on. The next thing would be pressure. If you have too much pressure, generally people with very high pressure have a higher chance of leaks and mouth leaks and keeping your mouth open. So talk to your doctor. If your AHI level, your apnea-hypopnea index, is around a 5 or below 5, generally you can take your pressure down a little bit. So perhaps you started at a pressure of 10 and your AHI was 9, but over time you lost some weight or made different lifestyle changes, got a better mask, and now your AHI is a 4, okay? At that case, you can probably bring down your pressure a couple notches, and that's gonna help with that dry mouth. The next CPAP side effect I wanna talk about is redness, kind of like a redness rash around your nose or wherever the mask is. There's 2 solutions I have for this. Number 1, you could get like a CPAP lotion here. This CPAP lotion here is specially formulated not only to hydrate and moisturize your skin, but also kind of work as an additional sealer with the CPAP mask. So it's not going to degrade the silicone of the mask, and it's actually going to help you have a little bit better seal. So you can try a CPAP moisturizer like that. Another thing is getting a relief mask. I know not everyone has the budget to get a relief mask, but it is a good option. And what I mean by that is you get 2 different masks that touch different surfaces of your face. So for example, if you're using this mask here, full face mask, you might want a relief mask as this nasal mask or vice versa. So say you're using the P10 as your nasal mask, it's going in your nose, the pillows are going in your nose. Use this 5 days in a row, you're probably gonna get a little bit of redness around your nose until your nose gets more used to the mask, right? But if you supplement a full face mask just for one night in between that, you have a full 48-hour block where your nose can heal a little bit. But if you're using the exact same mask day in and day out, you're naturally gonna have a little more redness because your nose and that skin can never heal. So I definitely recommend getting a full face mask or a relief mask that just touches different areas of your face. Another plus side with that is if you get sick or something like that, and you can't breathe out of your nose because you're all congested, then you're gonna have a relief mask and backup mask ready to go. So definitely recommend getting a separate mask. And because you're not using it all the time, it's not like you're getting a second mask and you've doubled or tripled your mask cost, right? If you're only using it 4 times a month, once a week to just let your nose have a break, then you probably don't really need to replace it. As long as you wipe it down with some CPAP wipes or something, you can probably use it all year long without replacing the cushion, maybe even 2 years, because you're not using it every day. The next thing I want to talk about is aerophagia. This is like air getting into your stomach or stomach bloating. Generally, this is going to happen at either really high pressures where you're just naturally forcing a little bit of air into your esophagus because you're at that high pressure, or sometimes even pressure that, generally not low pressures, but pressures that are too low for you, if that makes sense. So generally, you're not really gonna have aerophagia if you're at a pressure of 4 or 5, it's less common, right? But say you should be at a pressure of 17 and you're actually using a pressure of 15, so having too low of a pressure can actually cause aerophagia as well because you're gonna have more sleep apneas or more apneas throughout the night. And that's gonna cause you to gasp, and sometimes gasping and then letting some air into your esophagus happens at the same time, so that can cause aerophagia as well. So just making sure that you have the perfect pressure, obviously easier said than done, will help with aerophagia. So talk to your doctor about that and just try to figure out if you are getting maybe a little bit too high of a pressure, a little bit too low of a pressure. Just try testing it out on yourself and seeing if you're noticing a little bit more or less stomach bloating. Now with aerophagia as well, it's a little more common if you are using a nasal mask and you are having your mouth open or you're gasping for breaths throughout the night with your mouth. Then in which case, if you are thinking that you might be in that category, try a full face mask. That might help with the aerophagia a little bit. The next thing is hard time exhaling. If you are having a harder time exhaling, you're gonna have a higher likelihood of aerophagia as well. So try to turn on your EPR settings in your device. And that's gonna allow you to use your CPAP machine a little more like a BiPAP, in which case, for example, if you're at a pressure of 10 and you turn your EPR to a pressure of 3, then your exhale pressure is gonna be a 7. Okay, so 10 minus 3 equals 7. You can have your EPR set to 1, 2, or 3 in your relief settings on your CPAP device. So check that out. To access EPR, we're gonna have to get to the clinical menu. Just take your fingers and put them on these 2 buttons here. Then we'll see clinical home. We're going to click settings, and then we're just going to swipe down. We're going to see EPR right there. We're going to click it on. You can change your EPR style, so you can have full-time EPR or just during the ramp phase. So we're just going to select full-time there, select OK, and then we have the EPR level. So like I said, with a CPAP machine, you have options of 1, 2, 3. With a BiPAP machine, you can have a lot more different levels. So we're going to have, for example, a 2. And let's go back up and look at our pressure. So our CPAP pressure is 10. So that means when we exhale, it's going to be an 8. If you are still having problems with aerophagia, oftentimes a bi-level device or a BiPAP device can help with that. So talk to your doctor about a BiPAP device. Now, I almost forgot, there is one more solution with the aerophagia. It's with your neck and the way your head is positioned. So if you have your head down kind of like that, you have a higher likelihood of just trapping air into your throat and going down into your esophagus. So you can try adjusting your pillows a little bit, try different sleeping positions. Often if you're propped up a little bit, like on a sleeping pillow, it's gonna help a little bit with that as well. So keeping your neck nice and straight and maybe even propping up a little bit on your bed might help with that. Now, the next side effect of CPAP therapy is just waking up throughout the night and just figuring out why the heck you woke up in the first place. Oftentimes that is just due to your CPAP machine. If you're kind of sensitive to variance, especially if you're using an APAP device or just the APAP settings in your device, meaning that the machine is allowed to make automatic pressure adjustments. That's why it's called an APAP, automatic pressure. And so often if you are using a APAP and you have fluctuating pressures, goes from a 10 to 11 to a 12 to 11, that might cause you to wake up. So if you have a too big of a variance, for example, say your general optimal pressure is like a 12 and you have a variance in your APAP between an 8 and a 16, you might want to start narrowing that down just so it doesn't fluctuate as much, and hopefully that'll keep you sleeping a little bit easier. Okay, so that's all I have for you today. I hope you found this video useful. If you did, please give us a thumbs up and consider subscribing. Take care.